welcome to another episode of the Maternity Show on African Renaissance TV with me, Sona Dabo. So this episode is quite important, and it's one thing that we look out for in pregnancy and childbirth, which is antenatal care services. So to discuss antenatal care services, its importance and what it holds for pregnant women, of course, we are here at Bundung Maternal and Child Health Hospital to do this discussion with Dr. Dado Jabi. Doctor, you're welcome to the Maternity Show.
Thank you very much, Sona.
We're so excited that you've accepted to be on this show. But before we go into the show proper, kindly introduce yourself to the audience.
Okay, my name is Dr. Dado Jabi. I'm a specialist in obstetric and gynecology, and then I currently work at Bundung Maternal and Child Health Hospital. So I went to the University of the Gambia, School of Medicine and Allied Health Sciences, and then I did my housemanship at Edward Francis Small Teaching Hospital for 2 years, wherein I was then posted to this facility at Bundung Maternal and Child Health Hospital, and then I sit to my exams, the primary exams for the entry for residency for the African College of Surgeons, and then also for Royal College of Obstetric and Gynecologists in 2017. And then we did not have a residency training here. So I continued working as a medical officer. And in 2018, we were lucky that the country was accredited by the West African College of Surgeons to do training for postgraduate obstetric and gynecologists and on other specialties as well. So I was fortunate to be part of the first batch. We were five ladies, and then 2 men. And then luckily for us, we can say that it was a success because we all are specialists now.
Yeah.
And then we are doing our quota in the obstetric and gynae department in the country. So I am the only one in the facility. Others are in Banjul, and then some are in Kanifing as well.
Wow, that's a lot of achievement, and congratulations.
Thank you.
For that. Yeah. So we also want to use this opportunity to congratulate you for being in charge of the new private maternity ward that has been erected in Bundung. So it's a very big achievement, but we will discuss how this would contribute to the work that you do here in Bundung, maybe at the later part of the interview. Okay. So just to begin the whole thing, I know a lot of women are out there sitting to listen to what exactly antenatal care services would mean to them. So let's understand what antenatal care services are.
So antenatal care service are usually the service that we provide to women from the time that they conceive to the time that they deliver. We have an antenatal care service here. And then even as a country, we have a policy when it comes to antenatal care service. Currently, we are using the positive pregnancy experience, wherein we usually encourage the women to book very early from the time that they know that they are pregnant, usually from their 9th week to the 13 weeks. And then usually we book them that early so that we can follow up these women closely, because the whole process is a screening process to know those that most of the time pregnancy is a physiological thing, that they will have a normal pregnancy that will go on without any problem. But then there are for some women along the line, you will pick 1 or 2 things that are abnormal, and those people you need to concentrate on them more. So those that are low risk, that is those that they don't have any complication, either obstetric or medically, we usually have 8 contact visits with them. Okay. So you book them maybe as early as 9 weeks to 13 weeks, and then that is their first booking. It's when you see these women. The first booking, the things that are encouraged that we do for these women is to have an ultrasound scanning, which is extremely important because you want to know where this pregnancy is, whether it is inside the uterus, that is the womb, or it is outside of it, which is another condition. And then the other things that you want to do for these women is to do their labs, like laboratory services that you need to do for them, so that you screen them that they don't have any other disease, or even if they have those diseases, you can take care of them as early as possible.
Yeah, I think that is kind of preempting my next question.
Oh, okay.
Notwithstanding, let's just understand why this is referred to as antenatal in the first case.
So the whole thing is a Latin language. Okay. Ante means before, and the natal is birth. So that is it. That's why they call it.
Before
Latin
birth.
is a very old language when it comes to humanity and all that. So that is it. It started way back since 18th century. So that is it.
So you did mention that a woman should start this before birth process once she realized that she's pregnant. So because I've seen women that will go to the hospital when they are like 4 months pregnant because they don't even know that they are pregnant in the first place. Let's understand when the booking really starts for these women.
So what we encourage women is as soon as you miss your menses, because that will show that you are pregnant. So as soon as you realize that you have missed your monthly menstruation and then you are sexually active, you need to go to the hospital. So when they come to the hospital, what we do for them first is to test whether they are pregnant. That is a pregnancy test. Once we confirm that they are pregnant, then we send them to do an ultrasound. That way we know where this pregnancy is exactly. So once we realize that, then we book them for their antenatal services.
So what would you need for you to be booked at a facility?
So mostly you don't need much. You just need to walk into a facility, be it a public facility or a private facility. Once that you can confirm that you are pregnant, then most facilities will actually book you, regardless of your status, whether you're Gambian or not, married or not. So it doesn't really matter.
So what documents would you look at? Probably maybe an ID card or birth
certificate? So those ID card, yes, for Gambians, because we try to discourage people that are not 18 from getting pregnant. So mostly we encourage women to come with their identification cards. That is a national identification card. But if you're not a Gambian, whatever legal document that you have, you can work with it into a facility and then you'll be booked.
Okay, nice one. I thought it involves a whole lot of process.
No. It's quite simple.
Okay, then that's easier because I still cannot get why women would refuse to go to the facilities to have their services. But notwithstanding, gradually we will get to that part. So let's understand, once they are booked from their first attempt, what do you do and what intervals should they be coming back to the hospital?
Yes, so once they are booked, as I said, we do an ultrasound for them, which is very important. Apart from the ultrasound, we send them to do other laboratory tests that to check their HIV status and then the hepatitis B and C, and then to do their urine samples to see whether they have any infection, the stool samples to see whether they have any infection in those ones too. And then we give them an injection, that is the tetanus injection to prevent that from transferring to the baby. So if we check your HIV status, we realize that you are positive, then we start you on ARVs as well, because we want to prevent the mother-to-child transmission as much as possible. So the earlier we start these things, the way better for both the mother and the baby as well. So apart from those things, we the hepatitis B and C and then the urine. So those are the things that we usually do for them. So the interval that they usually come in, when you are booked, we usually target them for the first trimester. So that is up to 13 weeks. So you have your first visit that. And then we book you for 20 weeks. And then when you come at 20 weeks, we start you from for the malaria prevention therapy. That is the IPT, that is FANSIDA. We give you that. And then we send you for an anomaly scanning. That is those we feel that might have a baby that might be abnormal. We send you for that, and then you do that scanning as well, which is very important because at that point, we expect the babies, most of the internal structures will be formed by then. Yes. So if that is your first pregnancy, we'll give you a repeat of tetanus injection as well. So after that, we send the next booking will be at 26 weeks. So at 26 weeks, we repeat the malaria prevention therapy as well. Again, at that point. The FANSIDA. And then we will give you anti-helmet. That is for parasite infestation, because that usually might affect the women, and then it will reduce their blood volume as well, that they become anemic. And then if you are rhesus negative, that your blood group is negative, and your husband's is positive, because it will affect your subsequent pregnancy. And then we'll give you anti-D at that point, or we'll give you a schedule for you to come for it at 28 weeks. So, and then at that point again, we like to repeat your HIV status. That is, if the patient is willing to do that again. And then your next booking will be at 30 weeks. So at 30 weeks, we will do the routine for you, and just the weighing and then checking whether the baby is okay or not. Then the next visit will be at 34 weeks. So at 34 weeks, because then you are very close to your time of delivery, we will repeat the hemoglobin, and then we give you another dose of IPTs again. That is the malaria prevention. Yes, and then at that point, we might send you for a scanning. For your next visit, you should come with that. Because we need to see whether the baby is lying properly at 36 weeks, whether the fluid that they are in is normal or not, and then whether the presentation, the fluid, and then whether the baby's well-being is also normal at that point. And then you will come back at 36. And then we reduce the antenatal to 2 weeks. Yes, because you are close to your delivery. So when you are 36 weeks, we repeat your hemoglobin level because you are close to delivery. We don't want you to go into delivery with being anemic, that your blood volume is low. So then we give you appointment for 38 weeks, and then we will advise you to pack your things and then watch out for danger signs. At 36 weeks, we tell you that. So then you pack everything, all the things that you need to pack, we put it in a list and then give it to you. And then you watch out for danger signs. That is, whether if you see that you are draining, water is coming down, you should report to the hospital immediately. If you are having severe abdominal pain, you should go back to the hospital immediately. If you are bleeding, you should go back to the hospital immediately. And then you need to look for somebody who is going to accompany you to the hospital. That is your birth companion, the partner that is going to be there with you. Be it your husband, and if your husband is, we prefer the men actually.
The men, exactly. Yes. I was coming to that.
We prefer the men to be, even during antenatal, we encourage the men to come with their wives for antenatal services because it helps. And then you are both educated together about the danger signs, about what to do. And then it becomes easy, even for the woman, that you are coming for antenatal, even though your husband is not pregnant, but then the person is by your side throughout the journey.
Pregnant. Let's
exactly. So we will advise you and your spouse that you should come to the hospital early. You should not wait until it is late, because we see some of those things that some people will deliver either at home or in their taxes.
Bad before arrival.
Exactly. So we don't like that in our facility. So that is it. So if you go all the way to 40 weeks and then you did not deliver, then we start preparing your mind that if by 41 weeks you haven't delivered, then we will have to admit you and give you a medication.
That
if everything is, yes, that will help you start the labor. Because pregnancy, we don't allow it to go beyond 42 weeks. So by the time you are 41 weeks, few days, we will admit you, give you a medication for you to deliver if you don't have any other obstetric complication that is countering that.
All right. So once you go to the facility, again, part of the services, would you guys give any form of health education, also activities? And also I've seen them do
the blood pressure
stuff,
yes,
and
so
weighing them as well.
Each visit, you will have that. You will have your blood pressure checked. You will be weighed. And then just so that we are on top of things. Because once the schedule I gave you, that is for those that with low risk. So once you are high risk pregnancy, that you have hypertension, you have diabetic, or you have a previous cesarean section or by 2, or you have any other medical condition, and then you have a specialized antenatal that your provider will schedule. Probably it will not follow the same schedule that I just mentioned. So that is it. So your every visit, your blood pressure will be checked. You'll be weighed, your urine will be checked, because those are all screening methods to know that whether this woman is a low risk or is a high risk pregnancy.
Okay, that's nice. So once that is confirmed, now that we are looking at you advocating for men to come and accompany their women, so they're looking at you right now. Let's just say you want to tell them it is important for them to come and accompany their women. So
the importance of men coming to the facility cannot be overemphasized. And then we encourage all our brothers, our husbands, to, come with their wives to the hospital. As a facility, for us, once you come with your wife, we even give you a priority that you will not even stay longer in our antenatal. And then if you are in the labor ward, it's very important, both for the bonding and then helping your wife. Because sometimes they will send these old women with with their wives to come for delivery. And then if there is a complication, because pregnancy, a complication can arise at any point, even during delivery. So when there is a problem that maybe we need blood urgently, maybe you need to go and buy a medication or something like that, the old women usually find it very difficult. Some will start panicking and all those things. But if you are there as the husband, and then it's easier for you to rush and get those, especially in part of blood. And then you can just rush to the lab, and then you can donate to your wife, or you can even make a quicker arrangement. Because the old women that we usually, because in each, you know, previously they usually said childbirth and antenatal is women's business. So it's even our old mothers and grandmothers that will say, no, you stay at home, let me go. But then I think we need to change those narratives that when your wife is pregnant, try to accompany her for antenatal. When she's in labor, make sure you're the one there. Don't send, you can come with the old men, but be there. It's important.
Makes more sense for the woman as well. So I would love to continue, but let's just take a quick break and then we will get back to it proper.
Okay.
Welcome back from that very short break. If you're joining us now, this is African Renaissance TV, and this is another episode of the Maternity Show with me, Sona Dabo. And we are right here at Bundung Maternal and Child Health with Dr. Dado Jabi. We're discussing antenatal care services. So before we went out for that break, we were looking at some basic important things that people needed to understand about ANC. So now I want to ask about something that really, it's kind of funny, but not funny, because I see a lot of women that would go home with medications and still put it under their pillows or throw it in the bathroom without really understanding what they should use the medicines for. I know one of them you mentioned was Fancida. So what are the other medications you give to these women?
So the other medications that we usually give them is called FIFA. It's a iron tablet, and then we give it to boost their blood volume. That is their hemoglobin level before they deliver. Because your hemoglobin level needs to be at a certain level before you deliver. So usually they will come with a lot of complaint that when I drink it, I vomit, when I drink it, I'm dizzy, and all those things. So what we usually advise them is, drink it before going to bed. Because you will just drink it and then sleep. It's easier. And then you are just going to be lying down. So, but then we keep on encouraging them. But apart from taking medications, we usually have health talks with these women, which is very important, especially about their diets, which is important, that it's going to boost your blood volume and then also your health in general, especially the green leafy vegetables and the bahals, the plazas, and then fish, egg, and all those things. Anything that you can afford.
They will say egg would give you a
no, there is no scientific evidence of that. So we encourage these women. You know, so most of them will come with this myth that okay, when they said when I eat egg, my child will not talk, or if I eat meat, the labor will be difficult. There is no scientific proof of those things. So we try to educate them each visit before we even start the antenatal service. We have a health talk regarding all of these things, and also regarding the danger signs during pregnancy.
All right, so let's wrap up the importance of antenatal care services. Maybe we can have this from the aspect of the woman, the baby, and even the society in general.
So the antenatal service is very important, both for the woman and the baby, because first it's a screening method for us to know that whether there is any disease condition, and then there are some that we can actually correct, and then those that are transmissible, we can actually do something about before the pregnancy advances, like the HIVs, those with rhesus negative, and then even those with hepatitis B, that there are things that we can do about those things. And even if you have any other disease condition, let's say it be hypertension, diabetic, or any other condition, we can manage them. So that's why the importance for antenatal cannot be overemphasized. For the baby too, we look at the baby. Is the baby healthy? Is the baby normal? Because if you don't come for antenatal early, we might not be able to detect that. you might just be carrying a baby that is abnormal.
Yeah.
And then by the time you realize it, you are just far into your pregnancy. And then you'll just be going through the trouble of pregnancy for nothing. So these things are important that you come for antenatal very early. And then for society, we keep on screaming about maternal mortalities. But these things should be everybody's business.
Yeah.
I keep on saying, when we want to reduce or eliminate maternal mortality in our society, it has to be everybody else's business.
Yeah.
And the only way we can do this is by booking for antenatals early, even before getting pregnant. If you plan to get pregnant, how about you just walk into a facility, try to check your own status, try to check whether you have any underlying disease that when you are pregnant is going to affect you. Book early for these antenatal services. The whole family should get involved. It should interest everybody that this person is pregnant and is in the family.
It's the other way around.
Exactly.
They keep it because they
so,
think it's
but then our society,
crazy.
what we do is we want to hide the pregnancy.
Yeah.
So it results in women not coming for their antenatal services early because they don't want people to know that they are pregnant. So they will wait until the pregnancy is showing, which might be around 5 months, 6 months. That's the time they want to walk into a facility and register.
And
it might be late. Exactly.
Issues.
Some of the things you cannot correct them at that particular point in time. So we keep on encouraging these women and their spouse and the whole family that come for antenatal early. Of course, even if you come early, we will not tell anybody that you are pregnant.
Yeah.
You just need to come and book, and then we do the baseline investigations for you, and then you go about your business.
Yeah.
If you don't show anybody your card, nobody will know.
Exactly.
But then, we women are trying. Now a lot of people are coming early, but then we keep on just educating them about the importance of
because we
coming to
still
them.
need more of them
Exactly.
to be coming. So after discussing that very important aspect, we want to explore options on probably what challenges you think is keeping these women, not just about the might around pregnancy, but you guys would also have challenges from your side, right, as to the challenges that will affect the antenatal care services.
Okay, so usually main challenge as a facility, of course, is of course getting these women to come and book early.
Yeah.
Most of them come quite late, which is difficult for us.
Yeah.
And then the other challenges are for us, we don't have a problem with antenatal because our antenatal is always overflowing.
I know, because it's like I even wanted to ask why is it called
so
our
challenge is usually how we can manage this patient.
them.
We know that as a country, most of our midwives, nurses usually want to travel outside the country, and then that's usually a challenge. And then the more we train them, the more they leave. So that is usually a challenge as a facility.
So
the human resources. And sometimes because our the number of women that usually visit our facility is high, so even the material resources is sometimes a big challenge. So those ones are usually our challenges here.
Yeah. So now that you have an addition of a private maternity ward, how would you say this would contribute to the quality care you give out to women?
So the private block is, I am really excited about it, and it's always so in my face because I felt that we are constrained when it comes to space as a facility.
Yeah.
The space is quite small, but then the number of patients that we usually see is quite large. So usually maternity service comes in peaks, like from August to December is usually very heavy. And then sometimes you will see women that, even though sometimes it's difficult for us to talk about it, but then they will come in, everywhere is full, and then some will deliver on the ground. Because we will tell them go to other facilities, and they will still insist that they want to deliver here. So those ones are usually a very big challenge for us. And then when our wards are full, sometimes you'll find 3 patients on a bed, which is very, very, very difficult for us as staffs of this hospital. So that's why when we open the private block, we are like, okay, we have 15 more beds. At least it might not solve our problem totally, but it will help.
Yeah, it's a step in the right direction.
Exactly. So those that can afford it, it's not so expensive. It's not like other private facilities. We just make small charges so that we can have our maintenance costs, that it will not depreciate to to a point that we cannot keep it. So that's why we attach the prices. It's just for the services, and it's just for the rooms, not the services.
Not the services,
We still offer the same services. So if you can afford it, you can just come. You have your privacy, you have your dignity, and then we give you a quality service that you can take care of yourself.
I think it's one of the first.
Yes. Yeah. So it's actually the first. It's sort of maybe a pilot, I can say, in public facilities, because this is the first private maternity facility that is in a public structure in the country. So we are trying to see how it's going to work out.
I mean, Bundung has been known for a lot of deliveries here and there. We just pray and hope that this facility would add to the good quality that you've been offering. So before we allow you go, Dr. Jabi, we will probably need you to give your final words to the viewers out there.
Okay. Thank you very much, Sona, for the interview. Thank you, the viewers. I hope that you will learn something out of this. And then I am appealing to my brothers, our uncles, our husbands, that when your wife is pregnant, please and please try to accompany her to whichever facilities you want to go for antenatal. And then let them go to the hospital early, because early booking is really important for every woman.
Thank you very much, Dr. Jabi. So we've all heard it from Dr. Jabi. He said early booking is quite important for every woman. All right, thank you very much, Dr. Jabi, for honoring our invitation. And we want to let everybody understand that this show is still open for partnership and sponsorship. Of course, this is the Maternity Show with me, Sona Dabo, on African Agents TV. Until we come your way again, bye from us.